Hi there, my name is Michael Harris. Welcome to Falling Up Radio. I'm really excited that you're here today. We have an amazing guest today, which I'm going to introduce here in just a moment. I want to get to him as quick as we can because he's got so much information to share with you today. Anyway, again, Falling Up Radio is really about finding ways to live your life the way that you want, getting rid of the clutter, getting rid of the pain, getting rid of all those things that maybe it's no longer working in your life. Where's my book? My book, Falling Down, Getting Up. You can get a free copy of this book here at the website, fallingupradio.com. If you're listening on one of the podcasts, iTunes or Stitcher, just go to Falling Up Radio and follow the links and you'll get a free copy of the book. So with that being said, I don't want to take any more time talking about my book or anything else. I want to talk about Dr. David Clarke. I came across Dr. David Clarke really just last year. I've been an explorer of really mind-body type thinking for a number of years, not only with my yoga practice, teaching yoga, but also having stumbled across Dr. Sarno's material in the mid-90s, which Dr. Clarke may mention that as well. But I want to introduce him to you. Dr. Clarke, and I've got a long bio here. I'm not going to read it all, but I'm going to read a portion of it. He was clinical assistant professor, or is, of gastroenterology at OHSU, assistant director, Center for Ethics at OHSU. He teaches psychophysiologic disorder to internal medicine residents at OHSU. He is a faculty associate at Arizona State, and it goes on and on and on. He's a board-certified gastroenterology and internal medicine, etc. And he wrote this incredible book that I've been reading, almost done with it. It's called They Can't Find Anything Wrong. And this particularly fascinates me, not only because of past health issues, but seeing and hearing this from friends and students, etc., that go into the hospital and they can't really find anything wrong. I've got another couple of paragraphs of Dr. Clarke, but I want to jump right in and Dr. Clarke, I asked him beforehand, and I'm just going to call him Dave. So, Dave, hop on in. It's really great that you're here.
Great to be with you, Michael. Always happy to spread information about this because so many people are not aware that issues like stress in your life, both past and present, can actually cause real physical symptoms. They're not in your head. They're actually physiologically based. So this is a new idea. It's been around for a long time, but it's new in terms of being able to intervene in a way that's successful for patients. And that's the message we're trying to share.
Yeah, it's a great message. And, thinking that maybe part of my health conditions have been a result of stress, but oftentimes, somebody will say, or I'll hear it, well, yeah, stress, yeah, that happened to Bob, but that's not true in my case. So how can somebody really understand whether or not stress is affecting them and causing various symptoms?
Well, the only way to prove that stress is involved is to first uncover what the stresses are, and surprisingly often they're not obvious to the person. They may be struggling with things that they're not consciously aware of. This happens most often with stresses from the past, long-term impact of stress from when they were children, for example. But to prove that the stress is involved, you have to first uncover it, then almost always we can successfully treat it, and then we see the person's symptoms begin to improve in response to that or even go away. And that happens surprisingly often. But that's our diagnostic test. That's the way that we prove that somebody had a form of stress in their life that was responsible for the symptoms, is actually by curing it.
Yeah. Well, I've watched some of your videos, and they're fascinating, as well as reading the book and talking about the symptoms and diagnosing somebody. Is that the diagnostic protocol, so to speak, for stress is different than the typical test in imagery and that. Can you explain how the diagnostic tests really go? Because it's not done very often, as I understand it.
Yeah, most healthcare professionals, either on the medical side or the mental health side, have not really had any formal training in how to do this. And so it tends to be a giant blind spot in the system. But we always start with looking for an organ disease or a structural abnormality to explain the symptoms. We want to make sure the person isn't suffering from one of those. And nowadays, the diagnostic technology is powerful enough that if we don't find anything in that line, then it behooves us very much to go looking for stress in the person's life and see if we can find something there. Certainly, there are going to be a handful of people that they've got a rare disease or they have a disease that we just simply don't have a diagnostic test for yet. But the vast majority of people that no explanation is found, the classic, they can't find anything wrong kind of person. Nowadays, 21st century diagnostic techniques, the vast majority of those people, it's going to be stress of one sort or another, or sometimes more than one. So then we go into what I call the stress evaluation. And it's remarkable, how that a level of stress capable of making somebody physically ill could be something that the patient is not fully aware of. My favorite example of this was a patient who was hospitalized at a major university on the West Coast 4 times a year for 15 years with no diagnosis at all. And they even had a psychiatrist see her. But again, most even mental health professionals haven't been taught what to look for when somebody's physically ill. And that psychiatrist missed the diagnosis altogether as well. But I saw her back in the 80s when I was still learning how to do this, but by then I knew what to look for. And it turned out that all of her attacks of illness were connected to her having an abusive mother, mostly verbally abusive. And we could connect her attacks of illness with interactions with that person. And once she saw that connection, then it became very clear to her, and I can still remember to this day how she looked up at the ceiling and said, "Oh my God, I can't believe it," when the light bulb went on and she finally saw the connection between her illness and this very long-lasting form of stress. So that's how it works. We look for the stress, and there are several different kinds that we look for, and I can go into the details on that if you'd like.
Well, the story that you just mentioned, I believe, is in your book. Is that the story?
Yeah, that's actually the one that I led off with, because that particular patient was essentially cured in an hour after having been ill for off and on for 15 years. So
this person literally gets up, in Ellen's case, as you've named her, and walks out, and you've never really seen her again, or a year later she's perfectly healthy? Or?
Yeah, actually, she made regular trips to Portland, and she called me a year later to say she'd gone the entire year without having a single attack. And for her, that was remarkable, because she had been averaging 6 to 10 attacks every year of rather severe symptoms. They put her in the hospital half the time. So it was quite a prominent illness. And in her case, just that revelation of understanding the stress that she had previously not been consciously aware of was enough to bring complete relief, which is, I have to admit, it's unusually fast. A lot of my patients take weeks or months of treatment to get that level of relief. And some people need years of psychotherapy, to be honest. So there is that other end of the spectrum. But it just shows you what's possible if you know what to look for.
So Ellen's story, I've read it with great deal of interest, and looking at it from a little bit from what I understand from the ACE study, the Adverse Childhood Experience study. And it sounds like because of the verbal and emotional abuse that she was experiencing, she had some of the ACE indicators in her life, but it didn't manifest till a number of years later. Is that a fair assessment?
Yes, and that happens surprisingly often, that people who were mistreated as children, who had one or more adverse childhood experiences, they may not begin to suffer the symptoms, the long-term impact of that, until well into midlife. Now, certainly some of them began experiencing problems when they were still children or adolescents, or in the early adult years, soon after they leave the family of origin. But other people, they're well into their 30s or even older before the first manifestation. And it took me a long time to understand the process that can do that. You would think somebody who's a decade or two removed from their, let's say, abusive childhood, for example, that they'd be over it. And many of them believe themselves to be over it. And yet there is ironically, it's part of the process of recovery that can reach a sort of a crisis point many years into adulthood. And that is when the illness begins. My very first patient, the very first one, 1983, became ill at the age of 35, very severely ill, baffled 2 universities in Southern California with no answer to why she was so ill. And I accidentally stumbled on the fact that she'd gone through a very severe adverse experience as a child. And I didn't know what to do with that information, but a psychiatrist at UCLA, where I was in training, I got involved in the care of that patient at my request. And within 3 months, all of the physical symptoms had completely resolved. And that just shocked me. There was nothing I'd had 7.5 years of medical education at that point, and nobody had mentioned that such a thing was possible. So I latched on to Dr. Kaplan and had her begin educating me about what this was all about so that I could apply it to my own patients. And that's really how I got started in this.
So that was really your first exposure to it. Where did Dr. Kaplan learn this? I mean, was it through her own experience? Was it information that had been passed to her but was not very well known? I mean,
there have been writing about this condition dating back to probably the 1st or 2nd century AD in terms of understanding that emotions can be responsible for symptoms. There was even earlier information going back to Egyptian papyri from 1800 BC, Hippocrates, where they were encountering symptoms like this but didn't really know what to do about it. Galen was the first to really understand that emotions could be involved, and certain other writers down through the centuries have become aware of this. Dr. Kaplan, I think, was trained not only as a psychiatrist but in internal medicine as well. So she was able to blend those two traditions in a way that few people can. She also had a lot of personal empathy and insight into human beings, and by listening to them could understand things that they were struggling with that the patient themselves might not be aware of. And she passed on a lot of that skill in what she taught me.
It's fascinating. Like I said, I'm kind of a nerd about some of this stuff, and I've read Stephen Asanich's book and Dr. Sarno's book, and when I was reading Stephen Asanich's book, I was like, how is this person even alive? And how could that much of stress, etc., cause all those problems that he had? And then to be able to recover from that essentially completely. I mean, it's fascinating.
Yeah, it is what has gotten me so interested in this field and has kept me going with it. I became essentially a teaching physician 10 years ago because the kind of story that you just shared, the information you just shared, is so compelling to see people who are so ill, and it's remarkable the level of illness that this can produce. I've had many of my patients who were hospitalized over this. One of my patients was a 17-year-old girl who was, I was asked to see her on her 70th hospital day. And it turned out I was a gastrointestinal consultant for her, and I was number 7 that she had seen. She had already been to 2 universities and seen a couple in private practice. She was getting round-the-clock morphine for abdominal pains in doses that are typically reserved for people with advanced cancer, which she most definitely did not have. And yet, by uncovering the stress issues that were going on in her life and intervening successfully to turn those around. We got her out of the hospital in a week. She was off of all of the intravenous morphine and just on tablets, and we got her off even the tablets within a month. So, it's that kind of outcome that is just so rewarding as a physician, just to be able to turn such substantial levels of disease around just by talking to somebody, just by, having the insight into what's happening in a person's life. That my colleagues and I who do this work, we're constantly sharing these remarkable stories with each other and with the audiences of professionals that we teach.
Yeah, it's all, like I said, really fascinating, and we've exchanged a few emails about this. When I was 12, I had a water skiing accident, and I don't know if you knew who Dr. Timothy Campbell was. He was my surgeon, pediatric surgeon. And they removed 60% of my liver, which this was 1971, 21 blood transfusions, cracked ribs, collapsed lung, coma for 10 days, died. I came back. I was at Emmanuel Hospital. Good. And I healed pretty quickly, but I remember saying to my parents, I feel like I've healed from this, but emotionally, I don't feel like I have. And I need some help. And they were happy that I was just alive, right? And so, but then in '86, I started developing atherosclerosis pretty quickly, and with no underlying causes for it. My cholesterol, LDL, homocysteine, all those things were normal. And the email that you sent me was about childhood stress can cause inflammation of the arteries. I mean, is something like that potentially a stress illness that came about as a result of this adverse childhood experience?
That's a great question, and I wish we had the evidence to give you a solid answer.
Sure.
There's maybe an indirect clue in a study that was done just in the last couple of years that found that the more ACEs that you had, the more adverse childhood experiences you had in your life, the more likely you were to be hospitalized with an autoimmune disease. An autoimmune disease is one in which the body's immune system is attacking the body itself. And these are things like rheumatoid arthritis and lupus and multiple sclerosis. And, why in the world should that be? Why should, being treated adversely or growing up in a challenging environment result in hospitalization for these diseases many years later? And one of the speculations is that somehow that adversity turns on the inflammatory system in the body in a way that persists over time. It must persist into the adult years in order for this manifestation of autoimmune disease to take place. And there's also evidence that the more adversity you suffer, the more vascular disease you suffer, the more diabetes, the more cancer. Why is that? And it may also have to do with turning on the inflammatory system. So we don't understand all of those connections. We do know that there are connections between the brain and the immune system. There was a scientist named Robert Ader, A-D-E-R, who died a couple of years ago, who was the one who initially found some of these connections, initially in rats, but subsequently in human beings. So stress affecting the brain, affecting the immune system seems to be a plausible physiologic pathway that may result in some of these things. And I should add for the evidence aware in your audience that these diabetes, cancer, autoimmune, and vascular disease have been statistically controlled for risk factors like smoking and cholesterol and so forth. So it does appear to be an independent impact of the childhood adversity. So it could be that the stress that you suffered as a 12-year-old in some way was through this link to the inflammatory system was affecting your blood vessels.
Well, it's interesting because in my case, I really felt like for a number of years my emotions were suppressed, and I wasn't very good at expressing them or recognizing them. And I think since my recovery from my atherosclerosis that I've really developed that much more. And essentially for the last 30 years, I have not been sick.
And that's another area that I wish we had more evidence for. You know, I've certainly seen, you know, over 7,000 patients that I've personally treated where we've been able to help them with their physical symptoms that were connected to stress. And I've seen some corollary benefits with respect to addictions, eating disorders like anorexia or bulimia, cutting behavior. And I mean, when I say addictions, not just to substances, but often to behaviors like work, sex, gambling, shopping, eating. So there are a lot of sort of secondary benefits. Does this treatment to reduce a person's most deep stresses, does that also help with their physical health, their immune system, their blood vessels, their propensity to diabetes, their propensity to lung disease? We don't have that data yet, but it's a fascinating speculation that we may get some evidence to support in years to come.
Yeah, yeah. Well, I wanted to mention, and it's one of the questions or thoughts that I wanted to bring up. I mentioned that I picked up Dr. Sarno's book for the first time in the mid-90s. And I had started yoga in 1987. Initially, I was on a cane. And then in 1993, I started doing hot yoga, which is what's called Bikram yoga, hot yoga. And I started reading the material, and I was really fascinated, and I started studying with Bikram and Rajashri as teachers in the mid-90s, and I showed and talked to Rajashri about Dr. Sarno's information, and she said she said everything was TMS, and that was the mind part about the yoga. And that if you learn to relax the mind, your body will follow. Does that make sense to you as a researcher and physician?
You know, there's a lot of data about the relaxation response, a lot of data about the health benefits of mindfulness, of meditation, of yoga, you know, all of these techniques that seem to or actually do, you know, bring your stress level down. Mm-hmm. And being able to do that on a regular basis clearly has health benefits, and particularly for the population of patients who are suffering from stress-related physical symptoms. And those symptoms can, again, we should mention, can be from head to toe. You know, Dr. Sarno was famous for taking care of people with low back pain, but honestly, the symptoms can be anywhere, and it's not necessarily even pain. You know, I got into this because of people having gastrointestinal symptoms, so there are non-pain symptoms as well. But yeah, to get back to your original point, these relaxation techniques counteract the activity of the sympathetic nervous system, which can be in turn traced to the brain, where there are different circuits in people suffering from these conditions than healthy people have. Yeah. And it's probably those brain circuits in the brain that are being turned off by these meditative mindfulness, relaxation, yoga type techniques. Yeah.
Well, one of the things that I related back then is I was told by Bikram in class about, don't worry about it, forget about it, just do the yoga. Because I was all stressed out. I wanted him to give me all these corrections. And that idea, don't worry about it, forget about it, was probably the single biggest lesson that I've learned in yoga. But what I also learned, going back to Dr. Sarno's material, Dr. Sarno essentially was saying the same thing. Oh, don't worry about it, just you're going to be okay, go about your day. So I found a similar mindset, I guess, or thinking about that.
Yeah, I mean, so many people, particularly when they're suffering pain in an area of the body that they can voluntarily move, like the spine or like a shoulder or a knee, they are afraid they're going to do damage. But when the medical investigation showed that these areas of the body are not damaged, then the next thing you need to do is try to overcome the fear that you're going to be harming yourself. Because the fear magnifies the pain, and then the pain magnifies the fear, and you get into this vicious cycle. So if you're able to sort of mentally will yourself to dismiss that fear and just resume your normal daily activities, it can go a long way toward eliminating those symptoms, particularly, again, pain in parts of the body that move. Now, not everybody responds to that. Not everybody gets better. Some people, the symptoms come back. Sometimes they come back in a different part of the body. And for individuals with that experience, we need to go deeper. We need to find out, what is the stress that's going on? Does it have roots in adverse childhood experiences? Or is it that you lack self-care skills? Are you the kind of person that's taking care of everybody else in your world, but having difficulty putting yourself on the list of people you take care of? Are you suffering from depression, anxiety, or post-traumatic stress that hasn't been addressed yet? We need to look for those kind of things, particularly in people who aren't making good progress.
Yeah. So I know with Dr. Sarno, I mean, his first thing was about back. And he said he came from that school, and you came more from the gastroenterology side of things. But I know many people who, say, oh, I can't do that because I have a herniated disc or a slip disc or a pinched nerve and all that. And I'm pretty careful when I say anything to them, especially if they're a student, but recognizing that, oh, here's a clue that, it may not really be an issue, and knowing that there are a number of studies out there that with MRIs that show people that have no problems in their spine can have pain, and people that have problems in their spine, the slip disc, herniated disc, etc., may not have any pain at all.
Yeah, that's right. It's a big problem in back pain world, and occasionally in other parts of the body, that when you go looking for abnormalities, sometimes you're going to find them, but they're not relevant to the symptoms. And the best example of that is in the back pain world, where over half the population beyond the age of 40 will have something wrong with their spine if you do an MRI on them, even if they have no symptoms whatsoever. So if you go in to see a spine surgeon because of pain, and they get an MRI in your back and they find some minor abnormalities, and you don't have any pinched nerve symptoms to go along with it, there's an excellent chance that it's actually a form of stress that's responsible for your symptoms, and not the minor abnormalities that are just part of the aging process.
Sure. And that's fairly true too in the work that you do with gastroenterology, as I understand it, and from reading your book and talking to you today, is that they may have these intense abdominal issues or pain, symptoms, etc., but when you go in and actually take a look, you don't see anything. Is that correct?
Yeah, that's right. Although occasionally, a gallstone will turn up, and I've seen lots of patients who've had their gallbladders removed, and lo and behold, the symptoms don't change, and that's because the symptoms weren't really resembling a gallbladder attack in the first place. But the surgeon, they've got pain in generally the right area. They see a gallstone, they say, well, we better get it out of there, and so they do. But the majority of the time, when we go looking for sources of abdominal pain and we don't find anything, we're going to find a stress in that patient's life that can account for the symptoms.
Sure. And from I don't know the right way to ask this, but I know that I read things from time to time about microbes and et cetera in your intestinal tract and all of that. Does some of that get shifted when you're under stress, where some of those microbes may be acting up a little bit more, causing some issues, or is there just no change in that environment with the microbes?
Yeah, that's an active area of research, what all those microbes are doing in there. I think the New York Times just had an article about that in the last couple of days. And there's an entity that's gotten a lot of diagnostic attention called small intestinal bacterial overgrowth, where you get a test where you swallow some carbohydrate and then you see how long it takes for certain gases to appear in your breath. The test isn't 100% reliable, let's put it that way. And there's also an issue that a lot of my colleagues in gastroenterology are not aware of, which is that if you are under enough stress, it can actually slow down your GI tract. And if you slow down the GI tract, it can allow bacteria to overgrow. So it may be that the bacterial overgrowth is a secondary phenomenon to stress-induced slowing of the motility, the contractions of the GI tract.
Yeah.
And so but typically when somebody gets a positive diagnosis of small intestinal bacterial overgrowth, all the attention is focused on that. And the possibility that it could be stress involved in that patient's symptoms is ignored, which is really too bad.
Yeah. One of the other areas I wanted to talk to you a little bit about too was depression and anxiety, because that's mentioned in your book as well. And how does that affect us, and how does that affect the development of stress, illness, and so on? And is there a difference?
Yeah, well, these are two conditions that you can get without realizing it. You can get the disease we call depression without feeling particularly depressed. And the majority of patients in my practice that were referred with, who actually had depression as the cause of their illness, they would tell me, no, I don't feel depressed. Maybe they felt stressed out, they might have felt frustrated or exasperated, but they didn't really have that subjective sense of feeling depressed. And what they were in my office for was a physical symptom that was the manifestation of their depression. But you could diagnose the depression anyway because they had other manifestations of it, including poor sleep, reduced energy level, their appetite was off, they might be crying for no obvious reason, they might have lost interest in things that they used to love to do. And those are all secondary symptoms of depression. And when the person's got enough of those, you can reach a very solid conclusion that the disease depression is what they're suffering from. Anxiety disorders are the same way. Most of my patients with an anxiety disorder didn't really tell me they had a subjective sense of feeling worried or anxious or fearful. They might express that they were feeling a certain amount of stress, but anxiety or fear or worry, not so much. But you could get a solid clue that anxiety was responsible for their symptoms when you would learn that if they were in a safe place, anywhere they considered a safe place in their world, their symptoms were usually less severe or less frequent. And whereas if they were out somewhere that they thought was less safe, out in the world, out around large numbers of people, away from their safe place, then the symptoms would start to come on and become more and more significant or frequent the longer they were out there. So that was the clue about the anxiety. But these are both very common. They form a large percentage of the people who come in the door of a primary care practice. And you have to be aware that their main complaint of somebody with depression or anxiety is most likely a physical symptom.
Yeah. And one of the things in your book it talks about too is treating that depression with medication often. And are most of those people then on medication for a longer period of time, or is it a short-term protocol? And are they able to, in many cases, move through that through therapy, counseling, perhaps journaling and writing?
Yeah, there are lots of ways to treat depression, and everybody is different. Some people would benefit from short-term medication. I usually would recommend 6 to 9 months. But along with other forms of treatment as well, to see if we could address any underlying issues that might have been responsible for the depression in the first place, and allow the person to wean from the medication after that point. But lots of patients would do just fine without the medication, and would benefit from the other forms of treatment, whether it be counseling or journaling or reading about the factors that can produce depression. Same thing with anxiety. Some people were just, their symptoms were so intense that they really wanted a medication as a kind of a short-term crutch while they worked on other things. And, you know, happy to prescribe that for them. And if they had side effects, you know, try a different one for however long was needed until they could, you know, get back on their feet and be able to make use of the other techniques. Yeah. But the combination of medication and counseling and journaling and so forth was often more effective than either one alone.
Yeah, that's interesting, the journaling, because I hear about that more and more, and I've journaled for a good part of the last 30 years, and every morning, even today, I get up in the morning and I do what I call my gratitude journal, and I write things that I'm grateful for every morning. And, you know, I've heard other, like even like say Nicole Sachs, which is a big advocate of writing, and even from non-medical sources, people talking about writing and journaling. Can you talk a little bit more about how that fits into perhaps our mental health and our stress?
Yeah, it was a technique that I used a great deal in my practice, particularly with the patients who had survived adversity when they were children. A lot of those physical symptoms that they suffered were bodily manifestations of emotions that they had inside about those early experiences. And I would first try to connect them with those emotions by asking them to imagine a child growing up exactly as they did, growing up experiencing everything that they did as a child, you know, perhaps their own child, perhaps another child that they cared about. And that helped them to appreciate more accurately exactly how much they went through. By, you know, imagining it happening to yourself, you may not get the full impact as if you imagine an innocent child trying to cope with the same issues. And then once you've made that connection, then to write about it, then to write in a journal. You write every day, write, you know, all in one sitting, either way. And another technique was to write a letter to the person or persons who mistreated you as a child, not to mail it, just to write it, to get a chance to put your thoughts and feelings down on a piece of paper or typed into a keyboard, to try to convert them from being expressed via your body into being expressed onto a page. And I found that the more people could do that, the less their body took the impact.
Mm-hmm. I also, in your book, you mentioned about that importance of the self-care and for taking time for yourself every week. And you talked about 5 hours of self-care, not broken up, but 5 hours at one particular time.
Yeah, I found through trial and error that taking an afternoon a week, if you possibly could, and here, you know, it's not possible for everybody to do that. Some people, you know, could only manage an hour a week, but every little bit helps. And the concept there is to put yourself on the list of people that you take care of. So many of my patients grew up in environments where they were taking care of everybody else. One of my patients was managing the family checkbook for her 2 alcoholic parents starting at the age of 7. You know, wow. This was somebody who emerged into adulthood without the ability to put herself on the list of people she was taking care of. So she was, you know, fixing everybody's problems in her world. And you ask her, you know, what do you do for fun for yourself? And it was like, didn't really have an answer to that. So it's a skill. It's a necessary, essential human skill to be able to put yourself on the list of people you take care of. Go out there and do something with no purpose but its own joy. Something that's the moral equivalent of finger paints for a 4-year-old. And once you learn how to do that, then it's a skill you have for the rest of your life. But it takes time. You know, most of my patients took months of taking that afternoon a week to learn it, to get over the guilt when they first start doing it. and to just explore, to do trial and error, to find things that are fun. But once they learn how to do that, then it's a skill they have for the rest of their lives.
Yeah. One of the things that I look at with all of this, most of this work, like the stress illness or even TMS, is all really reacting to a, lack of a better term, reacting to a problem that's happened and then trying to fix it, maybe not in the traditional methods, but through the understanding of the stress and the TMS factors, et cetera, versus what if somebody has all these stresses in life, hasn't manifested anything yet, how can they live a life without manifesting all this stuff? Without having it to be reactive, that we're more proactive in our lives. And is that just that coming back to a lot of that self-care?
You know, I think that's a big part of it. But I think, gratitude, as you mentioned, is a big part of it. Self-esteem is a huge piece of a person's resiliency. You know, there's a lot that's been written about, how do we make people resilient to the stresses that life is inevitably going to throw at us. And the story that I heard over and over again from my patients, many of whom went through terrible adversity, was that if there was one person that believed in them, one person that made them feel valuable, that made all the difference in the world. And if you didn't have that, you can try to be your own best friend. You can try to be the person that where you persuade yourself that you have value. That human beings we're learning creatures. I mean, what distinguishes humanity from other species on the planet is our capacity for learning. And the most important subject we learn about is ourselves. And if we grow up in a dysfunctional or adverse environment, one of the things we're going to learn is that we don't measure up. We're not as good as other people, or that we have to be constantly vigilant, or that danger can appear from anywhere at any time. And it's important for us, if we've grown up in that kind of environment, to unlearn that and to look at ourselves as heroic. If we grew up in adversity, overcoming that is a hero's journey. A hero in our society is somebody who's overcome a difficult physical or mental challenge for a good cause. And my patients who've overcome childhood adversity, they've done exactly that. And if they can think of themselves as having been born on the far side of Mount Everest, and they've climbed up and over to get to be an adult, that's a huge shift in their self-image. And if they can get to that place in how they look at themselves, it makes all the difference.
Yeah, that's fascinating. I know you go more into that too in the book, and even writing the hero and putting it on your mirror and all of that. And it was just like, my feeling when I was reading that was just like, right on, Dr. Clarke, I liked it.
Yeah, and it's, so many of my patients struggle with that idea that they've been taught in so many ways that they were second-rate human beings, and that it became a fundamental assumption of their lives. And it's simply not true. It's a big lie. It's a big lie because the opposite is true, that they had to endure all that. They are actually like Olympic champions of carrying stress around. That they've got 400 pounds of stress on their shoulders that they don't know is there until they're finally able to put that down. And then they see their strength. They see exactly what it took to come through that. One of my patients, her parents divorced when she was 8 years old, but they continued to live in the same house. They slept in separate bedrooms, but they lived in the same house, and there was daily mutual hostility between them. It was just a horrendous environment. And it was only when she finally saw just how much she had to cope with, that she could look at herself as, wow, what a little kid she must have been to have dealt with that for so many years.
Yeah.
And that 180-degree flip in her self-image made an enormous difference in the rest of her life.
Yeah, yeah. We're getting closer to the end of our time. I did want to talk about two things, and especially since you just mentioned your patient right then, but I wanted to mention the story about Joaquin in your book, as well as the PPDA. So I was really fascinated by Joaquin and moving from California to Oregon and growing up in an extremely dysfunctional and abusive family, and helping this young man perhaps come out of that particular situation because of his anger and his fear. Can you mention Joaquin a little bit?
Yeah, you bet. He was a 16-year-old who was referred for abdominal pains that had been going on for months, and he'd seen a variety of clinicians. He himself thought that stress might be involved, but nobody had been able to figure it out. So we got around to one of the basic questions that I asked people as part of my evaluation, which was, did anything stressful happen to you right before your illness began? And nobody had asked him that up to that point. And sure enough, it turned out that right before his illness began, he had gone back to California to visit his dad. You know, his parents had divorced. And he hadn't heard from his dad in 6 years, not so much as a birthday card. But he'd heard through the grapevine that the dad might have improved himself from the violent drug abusing alcoholic that he was when his parents were married. So he thought, maybe there's some hope for reconciliation here. Make a long story short, things didn't go well. His dad wasn't that happy to see him. He offered him alcohol and drugs, but that was about it. And of course, this poor man was, young man was very disappointed by that, and just enraged that he had come all that way and only to be rejected. So he stole his father's pickup truck and drove it down one of the LA freeways at 50 miles an hour in second gear, and then drove it down the off ramp and shifted into reverse while he was still going about 50 miles an hour. And he proceeded to do that another dozen times until he ruined the transmission. Brought the now very noisy vehicle back to his father's place, had a big shouting match, and he came back to Oregon on the bus, just seething with anger and turmoil, and that's when his stomach pain started. But we were able to help him understand the connection between this experience and his physical symptoms, able to help him understand the emotions that he was having with respect to his dad. He wasn't so good at writing, so we had him speak into a recording device to get his thoughts verbalized, so that those emotions would be going into the recording device instead of into his abdomen. And he did very well, but it was just an absolutely classic case of somebody whose situation can be turned around quickly if you know what to look for. And you mentioned the PPDA. It's a wonderful organization that is a collection of people that do this kind of work. And we all talk to each other and communicate with each other, and we educate the public as well as healthcare professionals. The website being ppdassociation.org.
Mm-hmm. And so that's an organization that you're president of and that you formed, is that correct?
Myself, along with a number of other experts from around the country, yes.
Yeah, and is that your main emphasis today, is educating other health professionals as well as patients and other people on stress illness?
Yes, I go all over the United States, Canada, Europe. There's a lot of interest in this now, I think, especially because of the opioid epidemic. People are looking for an alternative to prescribing opioids for chronic pain. And this is a very viable option. There's a growing amount of research. The PPDA, in fact, sponsored a big research trial of patients with chronic back pain using our particular methods of counseling and comparing it with 2 control groups. And we're looking forward to that study that we funded in part being published later this year.
Wow. And so are you finding that physicians are pretty open to this idea, or is there still some of that resistance that maybe Dr. Sarno talked about?
You know, there was resistance when I first began speaking about this in the 1980s, but every year that's gone by, the resistance is less, the acceptance is greater. There's a wonderful, fairly good-sized primary care practice near Albany, New York, where they have adopted these methods in a big way, let's put it that way. And it has just transformed their practice. I've done a couple of presentations with them at national meetings, and once our presentation is over, they still can't stop talking about their cases, and it has given them such joy in their practice. These patients with this kind of problem, like Joaquin that we just talked about, very frustrating for physicians because they don't know what to do. And once they learn what to look for, once they learn what to ask about, all of a sudden, patients who are very, very frustrating become very, very rewarding. And it gives a lot of joy back into medical practice.
Yeah. Well, Dave, Dr. Clarke, I know that we could probably talk for hours on end about this stuff. And I look forward, I know that you have a series of videos coming out because I watched the first module the other day. And you've got 12 of those coming out, is that correct?
Yeah, it's modular. So a number of my colleagues who do this work are already proposing additional modules to add into it. So it's going to start with a dozen or so and going to grow from there. Yeah.
Well, I'm looking forward to watching all of them and taking my inner nerd and learning more about it. Are you planning another book by any chance?
I am working with a group of experts from around the world on writing a textbook, but I am insisting that they not put a bunch of jargon in it. And so far they are complying with that because we want the medical people to be able to read the mental health chapters, and vice versa, which means that if you're medical, you can't put your jargon in it, or the mental health people won't be able to understand it, and vice versa. So we're going to try to strip out all the jargon and have people write their chapters in English. And that means that even the public will be able to read it. So we're hoping to get that published in 2019.
That's great. I look forward to that. I'm sure I would dive right into it. And, I appreciate your time again. I know that you're a busy man and a lot of demands on your time. And how do you take care of yourself? Do you take your 5 hours a week?
I do more than that. Probably my personal best is playing with my grandchildren because they are just a delight and a joy. And I'm blessed with 5 of them, ranging in age from 1 to 9. And that is a huge personal stress reduction for me.
Yeah, wonderful. Well, thank you, Dr. Clarke. Again, to get his book, They Can't Find Anything Wrong. There will be a link here on the website at Falling Up Radio, or you can get it at Amazon. Can they get it through the PPDA, or is it basically Amazon?
Yeah, it's pretty much Amazon right now because it's been out there for 10 years and it's perpetually in the top couple % on Amazon. So I've been pleased about that.
Yeah, great. And all the listeners out there today, I really invite you to click on the links on this page, whether it's the ppdaassociation.org, to subscribe to the YouTube site, to watch all the different videos, but really to dive in. And I know on the PPDA site, there's a lot of resources on there to learn more about this. And it might be that you find something that might be able to help you, or maybe a loved one that's dealing with some type of illness that is somewhat unexplained, or maybe has some explanation and the stress is also affecting it. So again, they can't find anything wrong. Dr. Clarke, again, really thank you for being here. I appreciate all your time, and perhaps when your next book comes out, we can have you back on and talk about it some more.
It'd be a pleasure, Michael. I would look forward to it. Thank you very much.
Yes, thank you, Dave.